Hi, I wanted to talk a little bit today about periodic paralysis, about what it is and what it does and how it affects people who have it. Periodic paralysis is a rare illness. It can affect, depending on the type of periodic paralysis, anywhere from 1 in 100,000 people to 1 in 500,000 people. So it is very rare. It's also very disabling. But it is episodic. And so people who have periodic paralysis may be completely normal at times, and other times have very debilitating attacks or episodes. Periodic paralysis is considered an ion channel disorder. And ions are electrolytes or electrically charged minerals. And so what we're basically saying is that in people with periodic paralysis, there's something wrong with the way that the electrolytes go in and out of our muscle cells. Now, it's electrolytes that really make muscle contraction happen. This is why with athletes and construction workers and people who really use their muscles a lot, it's so important to remain hydrated and to have a balance of electrolytes. Now, in the person who has a malfunction in the way that the electrolytes go in and out of their muscle cells, this causes all sorts of problems. Besides the normal things that can go wrong when a person doesn't get enough electrolytes, the person with periodic paralysis has the extra challenge of having something wrong with those channels that deliver the electrolytes. And because we have several kinds of electrolytes, we have several types of leak channels that allow these electrolytes to go in and out of the cells. Because we have several types of leak channels, we can have several types of periodic paralysis, depending on which of the leak channels are defective. Okay, there's a lot that's involved in making a muscle contraction, but it starts with sodium and it ends with potassium. Basically, when a muscle contracts, we have sodium going into the cell, and we have other interactions with calcium and magnesium and whatever while it's in there. And then the end result is that potassium goes out of the cell. So it's sodium into the cell, potassium out of the cell. And this happens so quickly that it almost is at the same time. So in between the sodium going in and the potassium going out, there's interactions with calcium and magnesium and phosphate and chloride and all that as well. But to simplify it as much as we possibly can, we can say sodium in and potassium out, and that is what we're talking about when we have a muscle contraction. The problem is that no matter what the leak channel that is defective, once that sodium starts to enter the cell, and whatever goes wrong there, the end result is supposed to be potassium going back into the blood from the muscle cell. If the other things that lead up to that don't happen right, then the potassium leaving the cell isn't going to happen right either. Now, this doesn't mean that it's all about potassium, because remember that muscle contraction is going to take place when sodium goes into the cell, and then there's an interaction with all the other electrolytes, and then potassium leaves the cell. So something can go wrong anywhere in all of that. But what happens is that potassium doesn't leave the cell the way it's supposed to. So we can make the mistake of thinking that periodic paralysis is all about potassium, and it's not. A lot of other things are going on when those muscles are contracting and relaxing, involving all the other electrolytes. But the end result is potassium going back into the bloodstream. And so this is the marker. And this is what we end up looking for. Because if the potassium is not getting back into the bloodstream, or if too much potassium is getting back into the bloodstream, then we know that something went wrong when those muscles were contracting. And the marker that we look for is low or high potassium during an attack. So periodic paralysis is generally considered to be any time that someone has episodes of muscle weakness or paralysis, while potassium in the blood is either rising or falling.